Thank you, Dr. Bouchon and Dr. Rowe, for your leadership in crafting this legislation. And in a former career, I practiced law defending physicians and hospitals and medical liability claims, and also working for a law firm that represented plaintiffs in medical malpractice cases. The core principle, the core objective of the Affordable Care Act was, of course, as the name implies, to make health care more affordable. In fact, President Obama promised that premiums for families would decline by an average of $2,500 per year. The reality has been very different. Today, average annual family premiums in the employer-sponsored market have soared by roughly $4,300 since 2010, and deductibles are up an average of 60% since 2010 in the employer-sponsored market. Some of this increased cost is, of course, attributable to the increased taxes and mandates that are part of Obamacare. But much of the healthcare inflation that we've been seeing both before and since enactment of Obamacare is attributable to the litigation lottery environment and the failure of Obamacare to address the problems in the tort system, I think, is one of the core problems of Obamacare. We believe that Americans deserve health care reform that will help actually lower the cost of care and protect the sacred patient-doctor relationship. And I appreciate the fact that the American Health Care Reform Act, this alternative to Obamacare, includes legislation that I introduced called the Saving Lives, Saving Costs Act. And the purpose of this bill is to deal with the fact that over the course of their career, 75% of physicians will face a malpractice claim, and this liability climate is driving overutilization. It is causing defensive medicine, and that's increasing the cost of care for many Americans. Our bill would allow physicians who can demonstrate that they follow clinical practice guidelines, peer-reviewed clinical practice guidelines developed by the physician community, to benefit from increased liability protection in the form of a legal safe harbor. By reducing the practice of defensive medicine and increasing adherence to evidence-based medicine, we believe this legislation will lower health care costs while improving the quality of care for patients. And in fact, the Congressional Budget Office has estimated in the past that liability reform like this would yield savings up to $65 billion over 10 years. And this is an innovation on previous efforts to reform our malpractice system in that this is not caps on damages, and this honors federalism. So I appreciate the opportunity to be part of this important initiative. And now